I'm Edie Lush, and I'm here inside the Hub Culture Studio. It's Davos. It's 2022. Really pleased now to be joined by Othman Laraki. Thanks for coming along.
Thanks for having me.
President, CEO, founder of Color Health. Now, I want you to walk me into one of your, I want to say facilities, but it's not necessarily that. It's like a church where you are working with a community, or you're empowering a community to deliver healthcare, like vaccines, testing, that kind of thing. Just tell me why what you do is a little bit different than I might imagine.
Yeah, so we do a lot of work with public health and as well as employers, and to your question, so we run about 10,000 different sites in a variety of contexts, and so including churches, schools, community centers, etc. But if you take the church example that you were mentioning, the way it feels to the individuals, like one of our goals, I think quite different, is that we really emphasize making it feel to people that it is part of their community delivering basic care to them. And so what Color does, that we spend a lot of effort building great technology, focusing on logistics, solving all the kind of I think for a lot of people think that healthcare is about science and medicine, but in reality, I think some of the biggest challenges as well as opportunities are fixing the logistics and making that last mile. How do you get basic access to happen for people? Because when you don't have an emergency, it's the death by 1,000 cuts. That's why we don't go for annual screenings. That's why people don't take their chronic disease medications and so on. And so our model is to take that care and integrate it with your life, and that's how you serve the most underserved communities, and even people who can take the time off work and take etc. We all have life that gets in the way, and so we try to take healthcare to your life so that it doesn't get in the way. And so
it sounds like you're doing a kind of one-click buy, but with healthcare.
Yeah, no, exactly. So for example, for people coming into a church, it's it feels to them, it's the members of the church make an announcement hey, we're running a vaccination sites every Saturday, for example. Here's a link to sign up. It's takes 30 seconds to get scheduled. All of your information is there. You show up. Your members from the community in the church.
So it's not you guys.
Almost none of it is directly our people that are doing it. It is, we really emphasize having people from the community actually running these sites. And so you show up and it's people that people that are part of your community that are using our tools, integrated with our logistics, delivering care services to you.
So how does that do to increase trust? Because I know when I've spoken to folks who are delivering last mile vaccinations in some of the poorest parts of the world, the issue isn't, what the issue is that they don't trust what's going to happen to them. They don't actually trust the vaccine. So how does what you do with a community affect that?
Yeah, so most of our work is in the US, and it's exactly the same problem in the US, especially when you're dealing with underserved communities and minorities and so on. Is that when you think healthcare is being delivered by these other people that are not like you and not part of your community, it just adds another layer of burden of belief that you need. But when all's said and done, right, I think there's, if you think of the population's distribution, there are some people who really want to get care or vaccinations and so on, will jump over walls to get it. There's some people who are convinced it's terrible that and unless you're going to force them to get vaccinated, they won't. But I think the majority of people, the core of the distribution, are people that are going to be just influenced by friction. And so,
it's hard, example, they won't do it.
Yeah, and your example with the one-click checkout with Amazon, it's that is why we, the rest of our lives has been transformed through technology by reducing transactional friction, right? Why Amazon has one-click checkout, why we have search boxes in the browsers, why we listen to more music on Spotify and so on, right? But we've never experienced that in healthcare, and I think that is actually one of the biggest opportunities, is to just make all the things that we should be doing, in our health, just integrated with our lives, so that it's not a big transaction, a big decision for each person.
That's interesting. So you've said that equitable and accessible health is often not seen as where innovation happens or is needed. What do you mean by that?
Yeah, because innovation, A, costs money, and B, is, I think, driven by promise of rewards. And in general, in healthcare especially, I think people see innovation, and the edge where innovation happens is in science and medicine, in so that's why we invest so much in pharma, we invest so much in developing new tests and so on. But we think that, that last mile and delivery is just labor, and it's just kind of like low skilled labor, and just like turning the crank, and we just think of it in a brute force way. Whereas what we found is like that is a place where technology, I think, has the biggest potential. Like in my mind, you can think of technology as magic, but I think of it more as leverage. It's like a way to power humans to have more impact, and I think it's all about logistics. Like when you think about companies like Amazon, they don't do magic with technology. They just use it to solve really hard logistical problems, to make our lives easier. And I think like we just need to apply that to healthcare, not think of technology in healthcare as being this like machine learning to discover new drugs. We actually have incredible industries to discover new therapies, discover new diagnostics. But we don't have great technology to actually make it accessible.
So how is what you're doing in the US, where the social safety net is much, shall we say, has larger holes than places in Europe?
It's an understatement.
I was trying to be nice. But how does what you're doing in the US applicable elsewhere, where, for example, in Europe, where there is a national health, in most places there is a strong national health system.
Yeah.
How can you do what you do apply there as well?
Yes, one way to think about it is like I think two big sources of friction for people to get access healthcare, and again differentiating availability versus access, right? And so I think in the US we have two sources of friction, which are financial friction. It's like how do you transact around healthcare, how do you pay for it, and then logistical friction. In countries where you have socialized medicine, where they're like the government by default is funding a lot of like core programs, you take away some of the financial friction, we still have the logistical friction there. Okay. And I think that's where like what we do, I think applies, everywhere, which is like, I think in general, we have a deeply unsolved, logistical and operational problem in healthcare, where it's very similar problem. Like, if you're serving underserved communities in the US, it looks very similar to a developing country, right? And so I think that's where I think there's a lot of commonality and opportunity.
So it sounds like you're also reducing the trust friction, or the friction and trust. I haven't quite got that phrase.
Yeah, look, obviously, yeah. We should think of we should coin something good about that, and like how to articulate that well. Yeah.
I wonder if we just zoom right out and how what you're doing in terms of public health has the opportunity to reduce inequality and reduce poverty. Some of the global goals, all of the global goals, have been set back by what's happened in the last few years. How is focusing on the logistical aspects of delivering this kind of health, how will that affect poverty and inequality?
I mean, I think maybe one way to think about it is like, what are the big like edges along which inequality is expressed in our lives, right? And access to food, access to safety, access to shelter, and so on. But health is one of the big, edges along which inequality, both is expressed as well as impacts other parts, right? Like if you're not healthy, you can't study as easily, you can't go to school, effectively, you can't work, you can't, et cetera. And so I think the inability to have, basic health services really taken care of and accessible to people does impact their livelihood and exacerbates other inequalities in our lives. And so I think it's one of the places where the most like unjust inequalities happen to us, but also that has a cascade effect. Like all these things are connected, right? And so, and I do think one big mistake is to think that solving healthcare inequality requires solving all of society's problems. And I think it's one of those things where it rapidly becomes an unsolvable tangle.
Right.
And we just have to chip at all of them, at the same time, right? And so it's like, I think, in healthcare, especially in the US, I feel there's a lot of narrative about, social determinants of health, and where, hospitals, for example, are saying, we're going to be in food delivery. Whereas in reality that that is not they're not even efficient at delivering healthcare to you. Right. Why should they be efficient delivering food to you, right? Like, and so I think there's sometimes like this like confusion about like what are we actually doing and what are we good at, and I think in healthcare there's like ample opportunity to just do that really well, and so at least that's how I view this. This opportunity.
It's why one of the Millennium Goals around healthcare for all became one of the Sustainable Development Goals. But Othman, thank you so much for stopping by the Hub Culture studio here in Davos 2022, and I'm Edie Lush.
Thank you for having me.